This is one interesting case where we had an iris prolapse through the opposite clear corneal incision, which was given to reduce the amount of astigmatism. This is the preoperative full photograph of the patient before the cataract surgery was done, and we can see it's a visually significant cataract, some posterior subcapsular plus nuclear sclerosis, and the fundus was not visible, so an ultrasound was done which reveals a nearly normal posterior segment. Now interestingly, this is the post-op day 1 photograph of this patient, which was absolutely fine except that the pupil is dilated and the vision was good, that is 6/9, and everything was perfect at this moment. However, at the point when the patient visited at the day 7, I could see there was an iris prolapse through the opposite clear corneal incision given to reduce the amount of astigmatism patient had, and we can see this prolapse here, and this is the corrective surgery which was done. So this surgery was done under topical anesthesia, and once the patient was given topical anesthesia and a speculum was inserted, the first attempt was just to open the wound and allow the aqueous to drain out, and that would reduce the intraocular pressure and allow the iris to be retained inside. Once it was retained, then it was attempted to inflate the anterior chamber so that the wound or the self-sealing incision given for the opposite clear cornea would seal and provide no access for the prolapse of the iris further. So once the iris was deposited, and then air bubble was given in so as to push the iris back. But as we can see, there is still some amount of peaking present because a portion or a tag of iris is still adherent in the inner lip of the wound. A dialer will be used just to manipulate the iris so that whatever element of the iris tissue is snagged in the incision would get released. So this way it was pushed away, and again an air bubble was supplemented so that the chamber is formed and the tissue is kept away from the incision site. As we can see, the pupil has constricted and it is absolutely round in shape now, indicating that there is no entrapment of any tissue in the incision site. BSS was injected just to inflate the anterior chamber, and the patient was let off. This is the day 1 post-op picture when we can see the air bubble, and we can also appreciate that now the iris prolapse has vanished and the pupil is absolutely round. The patient vision was as it was before the intervention, that is 6/6 with correction. Thank you.